Welcome back to WIS News Prime Time. When first responders and emergency professionals respond to any sort of call, communication is key to ensure the person needing help is cared for properly. But when there are unexpected barriers when trying to communicate, offering proper care can be difficult.
DHEC recently developed a new resource to help nonverbal, neurodivergent, and non-English speaking people better communicate with first responders during emergency situations. And here to tell us more is DHEC's EMS for Children Project Director, Karen Moore. Thank you so much for joining us.
Thank you guys for having me.
Absolutely. Yes. Well, first, can you just kind of tell us about the cards you have in your hand to how they help with communication barriers?
Sure, absolutely. So this is a project that was done by the EMS for Children program, which is a federally funded grant. There is a program in each one of the states. Ours is housed within DHEC. We work with our hospitals and pre-hospital providers for better healthcare outcomes for children. So whether that's protocols, procedures, guidelines, things like that that focus exactly on kids. With our work with the hospitals, we also get to work with families, and our family advocates said, hey, we've got this idea and we really want to make it happen. And so they brought the ideas to us, and we went back and forth for a little bit, and then several years ago actually, and then COVID hit. So we kind of had to put it on the back burner for a little bit. And when we picked it back up, we said, you know, we want to make sure that we're covering everything we need to in these cards. And so we reached out to our national resources, so the other states, and we said, hey, do you guys have something similar? And they said, yes, we absolutely do. We'd be happy to share it with you. And so they did. And so we took those ideas and we adapted it for here. So we made our own.
Amazing.
Yeah.
You know, Karen, certainly in a situation like that, it's oftentimes traumatic for anybody that's going through it, but you can imagine just having that extra barrier that just makes it so difficult for some of these children and for others who just may not be able to communicate with first responders. This is making a big difference for anybody who's in that type of situation.
Absolutely, and like you said, it's not just for children, it's also for adults. We recently had a case in the upstate where a hearing impaired individual was involved in a motor vehicle crash, and during the crash their hearing device fell out and they couldn't communicate when EMS came. So they were able to use the cards and point to the pictures and determine their injuries.
Absolutely. It's just amazing uses. And can you actually show us a little bit of
Yes, actually, I can.
Just what some of them are.
Yes, so we've got, I mean, it's as simple as, you know, there's a paramedic EMT coming, a stretcher, you know, emergency contact information, you can fill that in as well. If your ear hurts or your head hurts, it's just a simple pointing. And then we also left the last page blank in case anybody wanted to write anything in there.
Like dry erase,
Yes, and they're totally reusable.
That is amazing. How long have y'all had these for and they've been implemented?
Well, like I was telling you, so the idea's been there, but as far as getting them printed and out in the community, it's been a couple of months. So we're excited. So it's still pretty new.
Absolutely.
Okay. Now, is a program like this being rolled out anywhere else, or is this?
Yes, there are some in several other states. I can't remember the list offhand, but yes, there's definitely some programs out there as well.
So what's your goal with these cards? Is it kind of for obviously medical professionals, schools even? It's really applicable to any and everyone.
Oh, absolutely. Law enforcement has been huge supporters of this program, and they've been reaching out for some cards. Anybody that we can get them to that it would be beneficial for, we'd love to.
Yeah, boy, I mean, I think when you look at a situation like that, this really could be the difference between life and death.
Absolutely.
For somebody who's in trouble and can't otherwise communicate. But that's got to give you a lot of pride to be able to come up with a program like this to be able to help.
It does. It gives the voice to the people who can't speak for themselves. So it's really inspiring.
Absolutely. And like you said, you've already had use of it that has saved lives and everything. Have you heard kind of feedback from community members, maybe law enforcement and other agencies that are using these cards?
Yes, just a couple of stories, you know, here and there about how, you know, they were able to communicate with children who couldn't even quite talk yet, but they could still point at pictures and let people know what was going on. So it's been great.
Absolutely. I think that is a good point, showing the pictures, and like you just showed us a little bit ago, sometimes you can't express how you're feeling when it hurts, but you can point and you can visually show what you need help with.
Right.
Absolutely.
Yeah, absolutely.
Not only that, I think those cards also run the gamut in terms of different emergency situations. I imagine that it was a pretty comprehensive process of figuring out the types of emergencies that people encounter. You probably had some buy-in from the agencies themselves to figure out what kind of cards are needed.
Right, and then also from our national partners. You know, they had been using the cards before us, and we were able to use their feedback and determine what we wanted to include.
Absolutely. Well, for people who are interested, how can people get these cards? What's kind of the process they go through?
They're free. Everything's free from the grant. You can reach out to us. I think they're going to put our email addresses up.
Yes, right there.
Okay,
There you
good.
go.
And also, you can also go to scdhec.gov and search for EMS for Children, and there's a link in there to request them as well.
Awesome. And I know you said they are relatively new in the past couple of months that they're actually being rolled out. Are there any plans for expansion and maybe like whenever y'all recognize, oh, this is a new card, a new queue that we need? Are y'all planning to kind of keep them updated throughout
Oh,
the time?
absolutely. And I think even incorporating some additional resources would be
Yeah.
great. So we're going to continue to work and collaborate with our nurses and our families and make sure that they have what they need.
Well, it's a great start and making a huge difference. Thank you so much for coming on.
Thank you for having me.
We appreciate it. All right, let's get over to Chief Meteorologist Adam Clark taking a look at our forecast, which looks pretty good for these next couple days.
It does, and with the drier weather that we've seen,